Hi, I'm Suzette. I'm a student of physical therapy, and today I'm going to be talking about assessment and interpretation of heart rate and pulses. And I'm going to explain you the right way to check your pulse so something like what we saw before doesn't happen to you. Heart rate is the number of times the heart beats in a minute, which is the number of times the heart pumps to push blood around the body. Pulses help us determine the physiological response of a patient to a physical activity. Resting heart rate, which is our normal heart rate when we are not doing physical activity, give us a baseline to compare later and to have an idea of the condition of the patient heart so we can know if they're safe to do an activity. It is usually assessed before starting a physical activity, and the normal resting heart rate for adults is between 60 and 100 beats per minute. We assess pulse, we analyze the rate, that is the number of times the heart beats per minute. The rhythm is the pattern in which the heart beats, and it can be classified as regular or irregular. And the quality is the strength of the pulsation, and we record this one using the scale that you can see in the screen that ranges from 0, that is an absent pulse, to 4 pulse, that is a very strong hyperactive pulse. So in the following part of the video, I'm just going to demonstrate how to assess and document pulse. I'm going to demonstrate how to take the pulse. So we place the index and the middle finger in the area that we want to find the pulse. So we're gonna do the radial pulse. It's gonna be in this area here. I'm gonna count for 30 seconds. Plus 25. And multiply 25 times 2. That'll be 50 beats per minute. The rhythm was regular, and the quality 3 plus. And that's the way we document the pulses. In the next part of the video, I'm just going to show the different palpation sites. The carotid pulse is below the angle of the mandible, medial to the sternocleidomastoid muscle. The radial pulse is in the anterior lateral wrist between the tendon of the flexor carpi radialis and the shaft of the radius. The ulnar pulse is going to be proximal to the pisiform and proximal to the palmaris longus tendon. So the brachial pulse can be found between the bicep muscle and the tricep muscle in the medial side of the arm. The other pulse is the posterior tibial pulse that is inferior and posterior to the medial malleolus. The dorsal pedal pulse is between the first and second metatarsal bones on the dorsal side of the foot. The popliteal pulse is in the popliteal fossa at the back of the knee, and for this one we push up with our fingers into the popliteal fossa and push down with the thumbs around the knee. The femoral artery is between the anterior superior iliac spine and the pubic tubercle and distal to the inguinal ligament. So the last pulse is the apical pulse, and for this one we have to find the fifth intercostal space. And then we're gonna draw a parallel line from the midclavicular line, and then we're gonna move 1 inch medially, and there is gonna be the apical pulse, and for this one we're gonna use an stethoscope. So while assessing pulses, do not use the thumb to palpate because it has an artery, so it will have its own pulse, and this can give you an accurate result. Also, do not assess carotid pulse on both sides of the neck at the same time because this will block the flow of blood to the brain, and the patient will lose consciousness, how we saw at the beginning of the video. This concludes my presentation. Thank you for watching.